Okay.
Hi there, here we are with our patient Dillon. Dillon is showing up after 10 months after we did a MaxHarvest Plus hair transplant procedure. And when I saw you out in the lobby, I literally almost fell over. His transformation is as good as it gets. He was basically a class 6, which means he was bald. He had a previous surgery with Bosley with very unsubstantial, mediocre at best results, was unhappy, did some research, found us, and we did this huge case on him, and here we are. What do you think, man? How do we do?
I'm thrilled with the results. Very much so, yeah.
You look different. Everything about you is different. Your smile's different. The way you carry yourself's different.
Yeah, I used to be bald, and now I have hair, and it's unreal. Yeah.
And you're young. We did your surgery at 29. You're now 30. So, I mean, how horrible is it to be a 29-year-old bald guy, and now you got your hair back?
And it's wild because it's only been 10 months, and in 5 months it was already growing like this.
So this is one of my unusual cases. About 5% of my patient population will do what he did. 5%. So I tell my patients, don't count on it. He just got very fortunate, and it's unreal. I'm so happy for it. But believe it or not, this first surgery is not even done growing. You're going to still see, I saw the back, you still have a lot more improvement even growing there. So when we do this next procedure on you, it's going to like catapult everything. It's crazy.
I'm very excited.
That's awesome. Are you using Propecia or Rogaine?
I am using Propecia, and I was using Rogaine.
Okay, perfect.
Yeah.
Okay, and you're going to continue to use both of those, correct?
Right.
Okay, very important. You got to stay on your preventative treatments. That makes it so we don't have a moving target. Makes it so we get you out of our office with the least number of surgeries. That's my goal for each and every one of my patients. Now, also, you were wearing a hairpiece back in the day, isn't that right?
I was.
And so, what do you say to the guy who's there, who's wearing a hairpiece and, bald? And what do you tell that guy since you've been to it?
In 4 months, you can have like this. I already started having like this right at 4 months, and there's no comparison. And you're actually going to be spending more money overall doing the hair systems than you will be doing this. So this is amazing.
Awesome, I love it. And I have to mention we have the famous Josh and Gorn back in the office today. Josh, is there anything you'd like to add to this?
Just the background. When Dillon first called up, I wasn't very positive about his likelihood of getting this kind of result because there was a massive amount of loss on top of his head. His donor was shaved down with the light hair. It just didn't look very dense. I did not encourage him at all, because guys who wear hair systems, sometimes our expectations are out of line. They want what the hair system does. I call them all or nothing guys. They want total coverage, front to back, thick and dense. We can't necessarily do that. Sometimes you can, but there's a limit. I say as great as Dr. Bolton is, he moves more hair than anyone in one session in the world, up to 16,000 hairs, leaves a smaller scar than what Dillon had previously, which is amazing. That's the ingredients that you want when you do a transplant. You want high yield, low scar. If you look at Dillon's hairline, there's no way in a million years that you can tell that this is a hair transplant. That's amazing. Everybody talks turkey. Listen, turkey cannot do a natural hairline. Turkey cannot give you total coverage from front to back. Turkey can't give you 14 to 16,000 hairs in one session without totally destroying your donor. So here Dillon's going to come back after 10 months. We're going to hit the back hard, and he's going to enjoy this the rest of his life. It's a great case. Like Dr. Bolton said, it's just amazing to see the transformation for this young man to go from where he was to where he is today in a short 10 months. And like Dillon said, in 5 months, he was looking good.
That's wild.
So it's amazing. And can't say enough what a great job you did, Dr. Bolton. That's fantastic. And
awesome. Thank you, Josh. And it's such a pleasure to have you back in the office.
Yeah, I talk more than normal because it's been so long. I apologize.
So, last but not least, what do you say to the guy sitting home?
If you're thinking about it at all, do it. You won't regret it.
Awesome, buddy. Thank you so much for doing the video. So happy for you.
Yeah.
The more great things to come.
I'm excited.